First of all, I would like to welcome Rhonda Stewart, is a clinical hypnotherapist and a counselor, and she's also a psychotherapist. And she lectures in hypnotherapy as well. She's highly experienced and has been presenting a lot of these cases on television program. In the early days, it was Bird Did a Show, if I understand. Bird Did a Show,
yeah,
who unfortunately passed away recently. So I've seen Rhonda a long time. We've known each other a long time. Dr. Howard was responsible to refer Rhonda to my practice. And something happened, Rhonda can explain. You sort of like how we approach. You said, look, I'm a psychotherapist, and I like how you manage patients, and the whole thing started from there.
yeah.
You're going to talk a lot, but I'm going to introduce a few things now.
Thank you.
A lot of you wondering why, psychotherapy and clinical dentistry. Well, it's an important part of communication. Now, we start in the college now, and a lot of you who are doing the college program need to learn to think about your psyche and the patient's psyche. The whole idea is to have both psyches in coherence so that everyone's happy and they're stressed, people understand each other, correct?
Correct.
And that's where you come in. Now, the other important thing to explain is the fact that it's a very unique webinar, this webinar, okay? You're going to talk about neuro-linguistic programming. We're going to talk about that. At the end, we're going to conclude with mindfulness. What is mindfulness? Now, everyone talks about mindfulness, but really, what is it? From the scientific point of view, you'll discuss it. Again, that should ask you lots of interesting questions. And because it's, a static environment, everybody's a cosmetic dentist out there, doesn't matter how you get there, as long as you get there, you need to know how to talk to patients, what questions are asked, and how to establish and maintain trust throughout the journey. So that's really important. And that's why we bring our psychotherapists. And most of the time, my advice would be not to bring a psychotherapist at the end of the game, but to bring her early in the game, yes, to establish what the patient needs and wants are, and what's the background and why they present your practice and for which reason, so that Rhonda will explain you, help you to understand this patient a lot better. So there's a third-party endorsement that in many ways allows things to go naturally smooth. That's what we want. So just to give you preempt, again, as I explained before, I'm going to throw in some clinical cases for Rhonda. For instance, I'm going to talk about what happens here and a lot of other factors that are involved. And patient, this was 9 months ago, and then things, this is 9 months ago. We'll talk about what happens later on. However, it's my pleasure to present Rhonda Stewart, clinical psychologist, hypnotherapist, and a counselor. So let's talk about this.
Thank you for having me.
All right, let's talk about this.
Okay.
And can I just mention one thing? This is Jacqueline, who's a very good friend of mine. She's a model. I've done all the TV show. She's given me permission to use her images because I've been thinking about this a long time. So the stage is yours. Please go ahead. I'm just going to be here and helping you to,
well, let's talk about this. There are lots of questions that may arise for you during this presentation. And if you have a patient that you would like to review with perhaps the idea of me giving you some new ideas, I'd love to offer that to you if we have time, Doctor.
Mm-hmm.
So my background is in counseling and hypnotherapy. I teach it as well. I've worked over the years in neuro-linguistic programming, and all of it comes together in a nutshell. When we look at NLP, neuro-linguistic programming, we're looking at the intricacy of getting into the psyche of how people think, how they make meaning. And it works with two things that are very important. One is physiology, and the other is body and mind. Neurology, physiology go together. And in the counseling model, CBT model, we look at the way you think creates the way you feel. And that can affect the posture of the body, the way people, utilize muscles in different parts of the body, and depending on what their life construct is, if they suffer things like anxiety or depression, or there's an underlying fear or uncertainty. In a medical environment, a dental environment, when they approach the practice, there can be an awful lot going on internally in a patient's mind that they're not prepared to just blurt out and actually state. So the presentation starts with your front staff. It starts with the people that say hello, introduce them, book the appointments, and start the journey in connecting them into a comfort and a relaxation, knowing they're in a safe place. And the communication then starts with the information that's relevant, but the way it's delivered is really important. And you can go into a clinical setting and find it's very, I call it rote learned, where somebody reads off a script and it's just given to you like that. And for somebody that has any underlying fears or uncertainties, doctor, that approach is going to have an expansion on the internal response. And we're going to have more of that anxiety and more of that stress.
What happens is a lot of these management programs, I won't mention any of them, they teach the dentist how to read the script.
Ah, okay.
So if the patient does this, here's the answer. They read the script, so memorize. So the problem is, it doesn't work that way.
No.
And most of the people who actually present who have major cases to be done, they're highly educated people. They're into the sales, into the marketing, they can easily read you. Okay, easily read you. So it might be a really good clinician, but as a cross, you come out as a terrible clinician because you're a bad salesman.
Yes.
Reading off the script.
Yes.
Is that right?
Exactly, spot on.
So it's not about selling, is it? It's nothing to do with selling.
No.
Selling in dentistry is a no-no. The problem is that there's a lot of people who want to teach dentists how to sell, so to say, sell shit.
Yeah, no.
All right? Yeah.
I understand that.
Yeah.
I mean, tell me if I'm wrong. I would imagine that the objective is to support the client's needs.
Absolutely.
And help them really clarify what those needs are.
100%.
So you're on the same page. And when you build that trust link, then somebody is going to be much more forthcoming with the information they offer, which then supports the dentist in a greater awareness and intuitive sense of the patient they're dealing with. And it can change the way you actually approach that particular patient. So then you're moving into actually working with the link of one person focus, where it's about that one person.
Exactly.
And so each patient is looked at differently.
Each patient is a prototype.
Each
right?
patient is a prototype.
It's a prototype.
And hypnotherapy is getting into the psyche of how people think and how they make meaning. And it gets into the inner realm of limiting fears and limiting uncertainties. So in that presentation, there are lots of things you can do in the front lines, which is your initial staff connection, in changing some slight language shifts can change. If you're listening to your client from a neuro-linguistic perspective, and your NLP is a form of conversational hypnosis. It works with the design of enhancing and modeling excellence and bringing out the very best within a person. Hypnotherapy is about finding the genius within and helping it bubble up into a conscious place where you empower someone. So if you have someone coming in with a lot of uncertainties, with some shifts in language, you can start to give them a kind of relaxation that just is viewable. You can see it. You see it, doctor.
It's interesting, isn't it? Patient presents, like our patient here before. This was 9 months ago. And there's a really good model talk about that. The teeth are failing, and she knows that. Okay, so look, in 9 months there'll be a lot of changes. You'll see the pictures later on. But here's a lady who's about 58, very elegant, gorgeous, beautiful lady. And she's got major gum disease. Okay, and because of COVID, couldn't come and see me. So she came today. Unfortunately, I couldn't get in touch with her to actually show her face, but she'll give me permission. But I had to close the eyes.
Yes.
We wish I couldn't have to remove the eyes. But for this reason, we have to do it because I don't have the consent. But nevertheless, lots of things happened in that 9 months. You couldn't come and see me. So you're not seeing another specialist. And how she was dealt with is something we'll talk about later on. And that's exactly what you're talking about. Okay. So we talk about a systematic approach towards patient management and case acceptance. It's an important basis to achieve clinically satisfactory outcome, right? It's very important, very important.
And you have that approach, Doctor.
I mean, thank you very much. We're trying to teach this in the college, and you'll be also lecturing in the college.
Thank you.
To teach them how to slow down. See, what really happens is most dentists see a complex case, and somehow the eyes light up. Because dollar signs come up, you see, and they can't wait to get the drill and just jump in there and just do something. And that's where the mistakes occur.
Yeah, huge. Okay? Absolutely huge.
And this is what we want them to think as a part of the, the introduction to college philosophy of thinking that there's lots of dentistry to be done. It's just every patient is different.
Individuals, exactly. Individual.
That's right.
And if they feel that link, that you actually get them, and it's not hard. Tiny little shifts can start the journey at the front desk. The person is connecting, and then by the time they get to the dentist, they're already in a relaxed place.
Relaxed atmosphere. That's right.
Yeah.
And I was going to say we talk about 20, but there's more than 20 plus key points.
There's more than 20 plus.
All right. And I sort of like this picture. What do you think of this picture? Tell me.
I think it's a fabulous picture. I mean, what I'm seeing is a beautiful smile, but I'm seeing a woman who's really enjoying showing that smile. So she's made that smile part of her identity, who she is. So she owns those teeth. She owns them.
Those
she enjoys them.
Belong to her.
Yes.
That's right.
That's exactly
that smile belongs to her.
Exactly. And so she's proud to show it. And it shows in all the muscles in her face. You can see the relaxed connection and the natural flow of a smile. There's nothing rigid about it. It's a genuine smile. Yeah.
Okay. And we want every colleague who's in dentistry to have that knowledge and skills. It's a life skill. They don't teach you this dental school. Even if you do specialty, they don't teach you in specialty. You have to live life.
You do.
You have to live life to understand this. Just because one is a experienced general dentist or one's a specialist means no difference. You have to live life, and that's what it's all about. Let's go next slide. I mean, the dentist-patient relationship. I mean, this is so important.
Look, it is, and as I said, if you've come from the front desk area and it's been a connection, then you start to build a relationship with the practice. So the next
it's a very unique area, isn't it? It's very unique.
It's unique, and it can be a barrier to somebody connecting with the next level, which is the dentist, or it can be a supportive link. And so the patient connects with the dentist. They've come in. They're feeling a connection with the practice. Then they're going to be more open to discovering what's on offer here. What can you help me with? And you'll find they are more open in communicating their fears, their uncertainties. And they'll ask you questions that relate very well to their life and what's going on.
Right.
Yeah?
So the question, what are the benefits?
Somebody's speakers.
No, it's okay.
No?
You need to write. Excuse me, can you write? I don't want to hear me. I'll mute you otherwise, please. What are the benefits of having trained psychotherapists in the dental practice? Would you please comment on that?
There are so many different points that I could reference for you. Some that I think are important that it supports the development of patient-dentist relationships by focusing on building the appropriate interpersonal relationships in the surgery. So it's creating a relationship in that environment. As part of the dental teamwork, as an advisor, educator and support, can be there for patients with their emotional needs, because that's a different area altogether. And it's an area that if the practice is an expansive one that is inclusive of aftercare support or pre-care support, it can make the transition of whatever the work is going to be done a much more, I don't know if it's always enjoyable, but a much more accepting scenario, a much more relaxed patient.
That's right. Sometimes as a clinician, we're too busy in thinking technically that how are we going to do this job. But now behind every tooth there's a live patient.
Yeah.
And when we sort of look at patients, and most of the time, rather than jumping there and trying to say what you need to do, but listening to the patient, it's a sort of a gaining trust momentum, isn't it? It's very,
Yes.
very important part. From your point of view,
Mm.
for instance, I do a lot of temperamental dysfunction, management of the patients.
Yeah.
And a lot of that comes from being very stressed, and there's some anxiety, there's other issues in their life,
Yeah.
which somehow they feel you, the dentist, won't understand, or I don't think the dentist should really ask you a question about how's my family support mechanism, how's my biopsychosocial mechanism that supports me, well, all you know is the teeth or the joints or mechanical, and the other sort of, and also Pooja, can you mute China, please? And also the other important thing is the fact that sometimes asking the patient, look, I have a psychotherapist and a counselor I really invite you to have a consultation with that will help you in your stress management and resolve some issues. You find that your treatment would have higher success rate because it's done in a less anxiety environment. That'd be.
You're spot on. In my own practice, I've had quite a few patients over the years that I've worked with jaw issues.
Right.
And anxiety is the background, exactly what you said.
That's right.
And in working with the anxiety, supporting and shifting and changing that, then they've gone to the dentist. And then the treatment's been a totally different
and they'll be more receptive to dentist treatment recommendations. They can clearly understand it.
Yep.
And having said that, what I find is most dentists talk to their patient when they're lying down. I mean, how good is communication when someone's laying down and you're on top of them? They're not hearing you, are you? They're not hearing you. So this is why it's very important to bring the patient up.
It's so important because that starting place is eye-to-eye contact. You're connecting with someone, and communication is received at the same level. And then in a reclined position, the relationship has been established.
That's right.
It's otherwise a very vulnerable position.
Yeah, Anitya Salnas talks about where does psychotherapists fit into overall workflow of the dental practice. We're talking exactly about that.
Yeah.
So that's a good question. We're going to answer you over the period of time. Please write your questions and we'll be able to answer them for you. Okay. I mean, would you say benefits of having, training psychotherapists in dental practice, just summarizing a little bit initially, is the fact that it allows you to understand the patient a lot better as to where they're coming from, because the old cliche that everyone's got a story to tell but won't volunteer. They may not volunteer to you, but they may volunteer to the counselor and psychotherapist because they feel more comfortable with her, because she's not going to be the invasive person, you are the invasive person. So they should inform you all their fears and their conceived issues, correct? That it makes
which assists the team in the dental practice in setting up their protocols.
That's right.
Really supports that patient's needs and establishes, perhaps some new directives with different kinds of clients.
That's right. Look, I have dealt with a lot of other counselors and psychologists before. From personal, I've known you for some time now. You come across as very comfortable, like an aunt they know, they're very comfortable with you. I find there's a good rapport with patients who listen and talk to you, and that to me is really, really important to me.
It's very important.
Today we lack that. It's like so to say, it's like hiring an auntie, isn't it?
Yeah, exactly. Hiring an auntie. I've got a therapist dog too.
Have you?
She does high fives. So
high fives.
She gets a relationship happening.
That's too. Wonderful. So we've talked about this. Now let's talk about benefits to the patient. I mean, I love that picture. Stuff we're trying to work out. I'm actually there, but they said no. It's like it's cut you out. So you're out. We got Jacqueline.
A beautiful woman in.
Yeah, she's out of focus. There's a reason for that. And I've specially chosen this. There's a reason for this. The benefits of the patient, and in terms of, let's just discuss this. Let's review. Okay.
Yeah.
The patient concerns and the misgivings about cosmetic dentistry. I mean, a lot of the work that I do is reconstructive cosmetic work.
Yes.
And people come to me because it may be technically fine, and dentist has done his best job and is taken on board.
Yes.
But patient's not happy.
Yes.
right?
Yeah.
Something went wrong, right? Because would you agree that when you do cosmetic dentistry, you're not really playing with teeth, but you're playing with people's minds? Would you agree with that?
Totally.
All right, because the whole, the eye is the reflection of what the brain sees to the world, and you have given patients something that the brain says, that's not me, right?
Yep.
Okay.
Yep.
How do you work that out? I mean, where do we go from?
Neuroscience, we look at neuroplasticity.
Right.
And we look at the pattern of habit, we could call it the ritual of a pattern of habit.
Just one second. This is not a vodka, this is a water.
I can
Just make it very clean, all right? Please go ahead.
So in neuroscience, we look at neuroplasticity.
Right.
So we have an old habit response that isn't working for the client, patient, and we start building a new habit response.
Okay, let me help that with the audience. Neuroplasticity terminology is cortical remapping.
Yes.
So it allows the synapses reform, form again, reform, is the ability to reform synapses. Now you learn something new, and your ability to inherently reform new synapses, it usually happens in brain cortex.
Exactly.
Okay? Yeah, please proceed. It's big in dentistry. It's very big in dentistry.
It's big in therapy as well, and other areas of medicine.
Yeah.
And I've worked with people that have had strokes, and we've regained the movement in the body.
From another pathway.
Building another pathway. So people get tics, and they come and see. You're going to have people with drop faces too, and it's possible to support a shift in that and an improvement in it, and support the client and change. So the beauty of neurolinguistic programming is really getting into the psyche of the mind and body, neurology and physiology, and building those new pathways, building a greater sense of self in many different ways. And when you have cosmetic dentistry, there's a change in who you are. It's a shift in your identity, yeah? And you're going to have patients that are very, what we call kinesthetic. They're very feeling minded. So the way they process and make meaning of what you're going to do and how you're going to do it, for them, they need a little time to absorb. So the journey of explanation, of review, is going to be a little slower. And in doing that, you're going to get the client ticking all the boxes and really aligning with you. Then if you have someone that's very visually focused, the images are going to do it for them, and they're going to be ready like that. They'll be the patient that you get who's just, okay, doctor, you've told me what I'm going to have done, I'm ready for it, and I'm waiting. And at the end of the journey, the look is going to be what makes them feel good. With the kinesthetic person, the feeling person, it's the way it feels in their mouth. So the whole journey is a little slower. And if it's worked in a slower process, it gives the adjustment time for neural pathways to stimulate and reconnect with this beautiful new shift and change.
Interesting. Very good. Very good. Very good. So in many ways, you're gaining a clear understanding about what to achieve with cosmetic dentistry. And understanding what patients look alike. In other words, we call it diagnostic mocha, where we tend to sculpt a smile in the mouth so you can see what they look like. And they give you opinion, what they feel. And that sets the stage for the journey. I see a lot of patients coming in, they've actually never had a chance to see what they look like or approve. It's always been the fact that dentist says, oh, don't write the temporaries. New ones will be really, really good. The trouble is, some of the temporaries are better than new ones because there was miscommunication about a lot of people with the laboratory. Patient was not an important decision process maker because the patient wasn't involved in the decision-making process. We teach it at the college in a very important way. Somehow, it's always a way where students say, can I just jump in there and do it? I said, no, stop. I know how to do, I know how to cut crown or to do veneers, whatever. That doesn't mean anything to me. It's how you're going to communicate this to the patient. That's really the key, isn't it? That's right. So in many ways, what we're doing is you're working with the patient who understands. You give a consensus process based on how much information you give to the patient. That's also an art.
And how they process it.
And how they process it.
Yes.
That's very important.
Yeah.
And when I see these patients, I'm not really sure about this. Usually my staff are heavily involved because there are things I don't read, but they read. So I get, okay, look, did the patient understand this? What do you think? Look, I don't think I said, okay, good. So they'll be here when I'm talking. I say, if you don't understand anything, talk to my staff.
And they connect.
Okay.
Exactly.
They can connect better. And that helps them in their neuro-linguistic programming, personal neuroplasticity. They feel more comfortable. If they feel not quite right, bring them back in for another consultation.
Exactly.
Right?
Yeah.
And that will relax the patients to allow to, have a clear understanding of what they need to do. So certainly review their concerns, right, about dentistry. That really helps them to benefit. Look, the other important thing, I guess you mentioned before, is about, clarifying, right, with their patients and their pre and post surgery concerns.
Oh, totally.
Okay.
Totally.
How important is that?
I think it is one of the most important components, because if you have a patient really clear before they start a process that there are steps involved and there are possibilities of delays based on what occurs, and they're informed, then you're not going to have a patient that comes in and says, doctor, this is taking too long. I think you're doing something wrong, or you've missed something, or if you're giving them all the depth and detail before, and you're clarifying the stages and steps, they're actually prepared for it better. And when it starts, they're in a preparation mode that supports the journey. So they have a realistic idea of how long it's going to take. Yeah.
Very well. Very good point. Very good point. I would also say, in terms of gaining clarity on the questions the patient needs to, clarification for a dentist, with, for instance, understanding what they hope to achieve in cosmetic dentistry. Usually it's about cosmetic dentistry or implant dentistry. There's all these problems. So if you're a periodontist, I have Dr. Boyatzis here on, he will probably need to explain sometimes if you have a gum surgery, you might have some sensitivity, you might have the little black spaces showing, and he goes through, and I've seen him do that to me as well, where you go through all the detail, although I know what to expect, but he'll still go into details with me in terms of explaining word by case, so you understand you're going to have these problems, you accept the consequences, but we have to do this to provide better access to the, to hygiene.
Exactly so.
That's very, very important.
And if you had a patient that wasn't aware of the possibility of a range of different things occurring post-operative, then you could scare them into a place where they don't come back.
Very true.
And they go shopping for someone else.
Well, people do go shopping. It's very interesting how there's an old saying which I kept on referring in our webinars is how careful you must be when you actually say those things to the patient. Because there's my father taught me this, and his grandfather told him, it went down into the family generation. That's the word saying, the Armenians suffered amongst Turkish, genocide, the Armenian genocide. So they were very quiet in what they say. The old saying goes that before you say anything, before you say the word, it belongs to you. Once it comes out of your mouth, it doesn't belong to you anymore. And same goes with patient management. Is that what correct?
Yes, absolutely.
Like, be careful what you say to the patient. Sometimes I have to try to, what the referring colleague said to the patient may not be what I would say to the patient. So I have to maintain a really fine balance to maintain everyone in a good line of communication. That takes a real juggling act, but that's what it's about. We do that all the time. So we cover this, right? How that changes the image perception. Now, what happens if the patient's got a body dysmorphia and the dentist doesn't really pick that up? I mean, where do we go from here? And suddenly, and this is the problem I've seen patients who's right on the body dysmorphia, dentist has been done, dentist didn't pick it up, and she's not happy. Where do you go from here?
Well, the benefits of seeing a clinical hypnotherapist or a counsellor. Hypnotherapy works faster because it works from the unconscious to the conscious. So it starts to heal internally where the limitations are and starts to build on identity. It's a key factor in it. So building on identity is helping someone discover themselves. So it's actually helping them discover all parts of themselves. And once you start building on that, then the value of different parts starts to emerge.
Yes.
And then the value, of course, your face is a major part of identity.
Most part. I mean,
Yeah.
look at the homunculus, the whole face is mainly about 70 to 80% of all the neural sensory perception,
Yeah,
senses
all
of light.
there. So once you've got that rolling, then the patient themselves will start to comment on what they like about their body, what they like about their face, and the smile will kick in, really will
Of course,
kick in.
yeah.
Yeah.
Very good, very good.
Yeah.
But some of those dysmorphic patients are very hard to treat because they have, you know, a number of other psychiatric conditions. It's very, very hard, and you need to sort of get other people on board before you treat that patient, because the minute you touch that patient, you're committed to that patient. That makes life very, very difficult.
That's correct. So having an assessment or a review to give you some tick-off points in what you're looking for that might need to be questioned more to support the patient.
Exactly.
And clarify what you're getting yourself into as a dentist, yeah?
That's right. And this brings us to the benefit to the dentist, right?
Yes.
I mean, obviously, what does this picture tell you?
Well, you've got a lovely smile.
Well, I'm happy because she's happy.
Yeah, exactly.
Right?
Yeah.
I'm happy because she's happy, right?
Yep.
And then basically she's reflecting the fact that everything's gone well. We've started the journey, and we sort of maintaining. I mean, it's all about the journey, isn't it?
It's about
when
the
you have
journey.
your patients, like how you start. It's not how you finish, but patients will always remember the journey.
The journey.
One day they remember how nice it was, the journey.
Look, they do. There's no question about it. Yeah. I had braces put on very late in life. I think I was 18 or 19.
Right.
But I was very lucky. The dentist I had, I was very fearful. I had no idea what braces were going to be like. Right. And he took the time to explain and take me through the steps.
Can you remember that?
And sure. I still remember it. Right. You know,
I mean, you're happy what you got, but you know this is there, but you remember the journey.
I remember the journey. Yeah, and it was a pleasurable journey.
That's right. In many ways, we just say benefit, there's not really benefit, there's actually benefit the patient, isn't it?
Yeah, it does.
Exactly. I thought so.
But you get referrals.
I think that's right.
You get referrals.
That's your benefit.
That's your benefit.
That's your benefit. That's right. That's exactly your benefit.
You get the referrals. And there's nothing more valuable than a referral.
Well, it's nice talking to you, you know. I'm enjoying this. Hey, you guys don't have to be around, you know. We're just going to have a talk.
we're really kicking in here.
Yeah, why not? Why not? Why not? I hope everyone's enjoying themselves, by the way. This is a very important topic. Now, a couple of more questions I'd like to ask. You know, and in many ways, a patient prepared to tell a story in an effective way that the dentist can relate to an overall view, right? Yeah. And that's like everyone's got a story to volunteer, but they won't volunteer. But if you make the patient volunteer, then you know the real story. You know the real story. That's the difference. It's all about the real story, isn't it? Doctor, it is. And too often in a practice, you can get caught up in, and it happens in therapy as well. It happens in medicine, where you get the briefest story and then you make meaning of it and work from there. Absolutely, absolutely. And just taking the time to get that gem, that pearl of understanding shifts and changes the whole scenario of where you're going with that patient. Would you say that in many ways, when looking at patients, right, they become your friends, don't they? Become like a lot of my patients are like my friends. I'm seriously, it's like you know, you treat them. This part of the mouth, is the most personal part of the person's part of the brain, let's say. Okay, and if they're trusting you to work on here. So you know what that is to me, doctor, and you know, occasionally I get a patient that says to me, "You believed in me before I believed in myself." Right. And I've seen you working in here. I believe that's what you do. You actually support the patient in showing them you believe in the changes being achievable. Yeah. That's right. So you start to get them into thinking, well, you know, if Dr. Sarkis believes he can do this, I feel a connection. He's very well educated. He's very skilled in this. I'm trusting. I'm feeling comfortable. And that's right. We also show them the other patient stories of the same journey. Exactly. And you know, we have a lot of videos, big videos, and the people, dentists who will do the program, they benefit from a huge library. You have over 3 terabytes of cases library. They get to see those cases. And if you're looking at them
like you do, which is individuals.
Absolutely.
Because you can see 10 people with the same problem,
That's right.
but they don't actually have the same problem.
No, they don't.
So it's that discovery that supports exactly what you end up
Very important.
working.
Very
yeah.
important. That's right. That's right. You know, they say it's not the light at the end of the tunnel, but it's the light within.
Exactly.
Okay, so
That's a nice one. I've got to remember that.
With pleasure. Happy to share that with you and with the audience. See, having a bigger picture, patient concerns around the service, which enables the dentist to have more depth of understanding to support the course of the action they take.
Yes.
It's so good, isn't it?
Oh,
you
totally.
wrote this. You wrote this.
Thank you.
I just compiled it into different parts, you see. This is a good point. It's a very good point. Did you write this in a matter of a couple of minutes, or you just thought about it? Be honest.
I'd had a glass of wine when I wrote it.
Yeah, what did you drink?
Shiraz.
Shiraz. I want to go Shiraz. Is that the one I get?
It's a really good Shiraz. He has great wine, by the way.
My pleasure. I do have good wines.
You do.
I share good wines with good people, always.
Thank you.
Okay, let's go to the next one. So it's all about also providing the dental team with a greater sense of what they can support, right? So see, to me, when the patient's here, my team understands my philosophy.
Yes.
And I also listen to my team. In other words, they'll come in and say, oh, we want to talk to you. What? We didn't like the way you spoke to that patient. So what did I do wrong? Oh, you could have said this, oh, gee, I didn't see that point. And I said, why don't you tell me before? I go, you couldn't shut up, would you? We just kept on talking. You're going to get us to have one word for it.
Yeah.
And that's important because you need to learn when to stop.
Yes. Yes, that's a valuable point.
You need to learn when to stop.
Yeah.
So when do you stop?
When I know the client is in a place where they're supporting themselves.
Right.
Yeah. From a therapy perspective, the aim is to sponsor change, not to create reliance. Yeah. But person-centered is really about supporting you and finding you, teaching you, how to fish for a lifetime rather than be fed for a day.
Exactly. Very good point. Very good. Thank you. I'm really enjoying this myself. So going to the next slide. And the awareness of the client's visual perception. Yeah. The way they see themselves and also see the world. Yep. And allow us the dentist to see what's realistic, right? Yes. Where you can correct it or be changed. Yes. Or there's a word that I love using, and it's called "Doctor, can you deliver?" Because promising the patient a word doesn't mean anything because you have to know how to deliver.
Walk the walk. You've got to walk the walk.
Can we call this listen to understand and listen to reply? Well, Dr. Nimesh, that's a very good point. I mean, listening, as they said, they gave you 2 ears to listen and 1 mouth to talk, isn't it? So listening is important. Listening is important, but what are you listening to? Because the key with listening is that, and it's a really valuable question, the key with listening is listening from the patient's point of view, not from your own internal filtering, because things you're very confident in. That's your answer, by the way, Nimesh. Go ahead, please. Things you're very confident in. You may communicate that back to the client, believing what you've heard. It could suggest to you that that is where they are. However, no two people think of the same word in the same way. So you need to reconfirm that what you understand is what the client's saying. High five. That's right, exactly. High five, yeah, done. That's exactly right. That's the important part. Yeah. Because you may interpret very differently what the client's saying. Exactly. And make your conclusions totally differently. Totally. So what I normally do is I take a video. I saw a video in this conference because you can't take a video. So then it allows me to go back to my video conferencing and say, that's so valuable because you can make all the notes, nothing. But video gives you everything. Video gives you everything. And the value of that, doctor, is that it's your patient's words, not your words. Not your words. And when you write your own words. So it's very simple video here. That's a video I take. It's a Samsung, takes a beautiful view. You can use your iPhone. I just find translating iPhone videos a pain in the butt. But Samsung, word file, bang, it goes in. Very simple. Very good, Nimesh. I'm really happy with your question. That's really well done. Yeah. And then, exactly. So, an awareness on what change will give them a different view of self. So, So, when you tell a patient, so here's the issue. Patient rings up to surgery. He says, I want veneers. And I said, okay. And I said, so how much a veneer? And then I said, well, I don't know. I mean, what do you need? I just want a veneer. We had a case last week, patient rings up in very much anger. He said, I want a free consultation. Sure, we don't give free
Of course
consultation.
not.
And he says, by the way, my time is very valuable.
Of course it is.
Very good laugh. So he said, I want 10 veneers on top and I want 8 veneers on the bottom. This is that. I said, well, how do you know? He says, I already got them and I'm not happy with it. All right. And I just found that they were made in China. So obviously, we realize where it's coming from, right? So he has low value place of dentistry. So he wants to get biggest buck, bang for his buck. Is that the right word to use?
Mm.
So this patient, when they come in your practice, it's going to be a major problem because you're not going to be able to keep them happy.
And that's the biggie.
Yeah.
What is happy for that person?
That's right.
That'd be the question I asked is,
That's right.
what are you unhappy about?
That's right. Well, it'd be interesting. You want to have a free consultation tablets. It didn't work out too well because I don't think it was the right patient. So we said to him, look, for sake of humanity, I'll give you 5 minutes, but that's all you're getting. So he wasn't happy with that.
Well, you're being realistic, doctor, because someone in that headspace is disappointed with where they've been.
Yeah.
And they're expecting you to fix the problem without paying for it.
Exactly. It's not going to work.
It's never going to work. No.
Because that will be your problem always.
Always.
Yeah.
Yep.
Somebody is on a problem. Okay. Somebody is on a problem. So if you don't communicate with your patient, you're on a problem. Yeah. All the way through.
It always happens.
Always.
That way.
Always. Okay. Always happens. So that's very important. So preoperative support and comfort relaxation for dental staff, because that reduces the problems. Okay?
Yeah.
Because you're angry, staff's angry, patient's upset.
Totally.
And then it goes, some bad review, and then it's all sorts of things. So better to nip in the bud, right? Okay.
Totally. And in my practice, working as a therapist, what I do with patients like that is I actually say to them, I can't give you any reasoning behind your disappointment elsewhere or what you expected and what you didn't get. All I can do is offer you an outline of what I do. And then it would be about you coming in with a different attitude, opening to the idea, I'm starting from scratch, I'm looking at things from a different angle.
Absolutely, absolutely. And the post-operative support is very important as part of the journey because you're always looking after them.
Always.
They're happy, and usually I'll bring the patient for an interview. I'm going to take a video after. So tell me what you think of your case. You were here, you were there. Are you happy? We talk about those things. Okay. Awareness, that is support to build a confidence. Some people need more support than others. So you have to make that decision.
Yes.
So this person needs more support. Yeah. Okay. So more time, more care. And then you're making a judgment call most of the time, aren't you? Although you're very busy. And what happens is patients sometimes come in at the wrong time, and unfortunately nothing can be done. Right? Nothing can be done. I agree. Oh, so that brings us to our patient initially. Now, this is a clinical, and I'm going to just make a few clinical decisions for dentists. Yeah. Can anyone see the problem here? Can you write down? Okay, I want someone to talk. I'm just going to give you a talk. The person who should talk, I believe, should be Nimesh. Nimesh.
Yes, doctor.
What do you see here, Nimesh? What do you see here? Just quickly.
Well, there's a beautiful lady here, and
on the seas. Okay, there's a pedal of the seas. There's teeth mobility.
I can say there is a missing teeth on the right quadrant 1, and of course. We can definitely look at the profile.
You're going to click. Yeah.
Am I going deep in clinical, or what do you want?
No, give me some idea. What do you see? I mean, she's 50, about 56. Okay. She's 56. Let me just...
Lost the back teeth support, basically. So I think.
All right. Okay. Good. Okay. Okay. Let's talk about this. What do you see here?
Okay, there is a midline shift. Of course, there is asymmetry there in the smile.
Okay, all right, fair enough. I'm going to show you a picture. Fine. Is this gum problems and some composite maintenance work done? There's lots of back teeth and there's mobility. So what do you see? If I saw this and I translate here, do you see anything else on the face at all or no? What is on the face? Don't worry about the
On
teeth.
the face.
Anybody? Okay, Nimesh, you stay there. Stay there, please.
Yeah,
Okay,
that's okay.
What do you see? Rona, what do you see on the face?
Well, I actually see relaxed muscles.
Uh-huh.
And I've had the privilege of seeing the lady's eyes. They actually were shining. In the pre-treatment, they were dead looking. You know, it was not a happy face.
Okay. Well, put it this way. Okay, this patient is gonna go, this is 6 months ago. 6 months ago. COVID, she couldn't come in and surgery 6 months ago, okay? There's a lot of things happen in people's lives. So people go through, you know, we haven't treated the patient yet. She's basically 6 months, she's deteriorated further. Okay,
Yeah.
far further. This is 6 months ago. Okay, so you know, you can see that she's lost an implant here, and that comes out. So you can see from here the implant was lost. Obviously, although she's smiling at this point in time, what happened was
still a work in progress.
well, we couldn't see her. We had to treat her. I mean, basically, you can see from dentists can see that what happens that there's the lower facial height is probably equal here. Okay, it's getting worse, but not having teeth, she's showing atrophy, right?
Yeah.
Atrophy means loss of muscle strength, loss of muscle support,
Mm.
and you can see more dipping here because there's less arch there.
Much more relaxed.
That's right. And she wants to keep the teeth to keep the face together, but not having teeth there, face is dropping.
Yeah.
So what happens at one point in time, and I explained this to the patient, that there'll be a point in time within the next 6 months they will go exert aging. You're going to age.
Oh,
Okay,
right.
it's unfortunate, but it's going to happen.
That's really sad.
And it's very sad, but this happens. This is the key.
Mm.
It's the key. Now, and she came in today. This is 9 months ago. My images I take a lot of pictures. As you know, I have immaculate records. But this is 9 months ago. Okay, it's 9 months ago. Same here.
Mm.
And this is today.
Yeah.
This is today. What's happened to the patient? Can you imagine? I'm going to show the next picture here. Can you see that she's
The base has changed.
She's got more lip.
okay? She's basically it's aging process.
Yeah.
And what's happened is that I'm going to show you some of the other pictures for you. Okay, where it's actually loss of more facial fat. The fat, usually the buccal fat, which you call starts migrating from here down.
Yeah.
And it's almost disappeared. So she's lost that cuteness that she had 6 months ago.
Yeah.
All right. And now she's lost, we call it a facial curtain. There's more teeth missing here. So, and basically chin and nose, this is like getting very close together. There's a loss of collagen, stress, anxiety has devastated this woman. And on top of that, when I saw a specialist, she was a gum specialist and a prosthodontist. And what they said to her was the fact that, look, you know, your areas are foul in your mouth, and we need to take your teeth out and put a denture. Now, that's basically what said to the patient. So she's 58, okay? She's 58. Imagine you're 58, okay? I'm more than 58.
That'd be nice.
Okay? And someone says to you, you're gonna have your teeth removed
Oh,
and
shocking.
dentures put in, all right? I mean, how do you take that?
Well, it's devastating.
Right,
Yeah. And you feel like you're losing something very valuable.
you're right.
And you don't know how you're going to cope with it.
Yeah,
You know, it's a whole range of fears and uncertainties. But for a woman too, it's an aging factor. You start to think, I'm getting old, body's falling apart.
now we know that our teeth are failing. We know that. Okay.
Okay.
How could a specialist, these are specialist people, one is a female specialist, there was a male specialist. So female specialist, a gum specialist. How could she have approached the patient to ease the pain of loss of teeth? There's a lot been written about loss of teeth, right? There's a lot of religion written on people's psychology because you don't lose teeth because you lose a lot of your senses. You know, but there's a solution for this. And we found a solution for it today as she came in.
Yeah.
But she was totally devastated until I gave her a solution. But how would then sort of ease the pain on this patient by saying, you know, how would you, I mean, what would another view that would take to explain to the patient? Yes, you will eventually lose your teeth, and there are ways to prevent.
So it's weighing up the options. It's saying, let me tell you the worst scenario, and let me tell you the best scenario. And our aim would be to work on the best scenario.
You see, there was a simple solution here, but the dentist refused to, or the both specialists refused to explain to the patient as a solution, to give us something fixed as a temporary. And we found a solution. She's very happy. I mean, that was already planned before. She knew about it, but she decided to get another opinion, which people do invariably. And the funny thing is, nobody thought about giving something fixed as a temporary, but they're all thought about giving some removable denture, right? And what it tells me is that, see, the trouble is that when you study, and people study whatever they do, doesn't matter. They like to look at the recipe. So everything is a recipe. So if it doesn't fit the recipe, I just don't know how to modify this. It's called neuroplasticity too. So
yes, exactly.
And they can't, I mean, they could find an easier solution. I told them there's another way to do it. They're going to do this way. And suddenly the whole world was reversed because I actually listened to the patient.
Yeah.
None of them listened to the patient saying, do you realize the patient doesn't want dentures? So having a denture means I'm going to be old, I'm aging. There was no sensitivity on behalf of the patient, what she felt. And what the dentist thought is the right thing to do. By who? By the university, by the textbook, I mean, or by the patient. Yes. So if it's a belief system, the dentist should go to church and pray to encourage his own belief system, right?
That's correct.
But that belief system doesn't translate to the patient, although she will lose her teeth, but how you explain that, there's another question.
It's very different. Yeah.
I knew a very good neurosurgeon. He had a perfect hair, better than mine. Okay. He used to shave his hair because every neurosurgical patient had brain surgery, they shave their hair.
Right.
So he purposely shaved their hair to relate to his patients.
Wow.
Isn't it wonderful?
Yeah. That is wonderful. And we can do that with body posture and adjustments and our hair.
I know I should lose your teeth.
And our language. We don't have to lose our hair. I'd hate to lose my hair.
That's right.
So there are many ways around it. But
so,
is the picture of us smiling is one you took after you chatted with me, yes?
No, this is 9 months ago. This is 9 months ago.
And the
9 months ago, she was fine.
Yeah.
She knew the treatment plan.
Yeah.
She was happy. But COVID couldn't see her for 6 months.
Yeah.
So she went to dentist and they said something to her. She was horrified, right? And they said, we're gonna, funny enough, she got 2 implants here, another one there. They're all integrated. And we basically gonna put another one here and then make a temporary, get rid of the rest of her free teeth, and that's fine. They'll deal with that.
But you've helped her find the recipe.
Yeah, the journey.
Yeah.
She was jumping off the cliff, right?
Yeah.
We just put another bridge across.
Yeah.
You say, hey, we're going to make that transition easy, and this is how you do it.
Yeah.
It's not brainy, it's not a brain to do that. All you have to do is just listen to the patient.
But a lot of people don't take the time to do that.
Yeah. And you don't talk to the patient in the down chair. You talk to the patient in here, in the clinic. If you don't have a clinic in your practice, not in an office in your practice, take them to the kitchen or take them to the coffee shop, whatever you have to do, get them out of the neurosurgery. Yeah. Because they can't hear you. They can't listen to your fearing. They fear the environment.
And in that laying down kind of position, you're very vulnerable.
Very vulnerable. Interesting. Very interesting. Very interesting. So, I love this. What do you think of this picture?
She's beautiful. We have to all agree with that. And
the
teeth look amazing.
Oh, she's amazing. I have no fear. I mean, that's very important.
No, she's confident.
That's right.
Very confident.
She's confident because of one important fact, the time we took to establish trust.
Yes.
Correct?
Yes.
You like that picture?
And she's a kinesthetic person.
That's right.
So the feeling of it all was very important.
This goes in the television, she's every magazine.
But that's also suggestive of trust,
yeah.
Doctor. It's suggestive of trust. Yeah?
Yes, yes. It's important that people feel comfortable to have that journey. And that means you need to be able to deliver as well, not because you're a good talker and you know how to convince patients, but you have to actually deliver the goods. And we'll teach at the college how to do that. That's very important. Okay, now I just want to say, any questions coming up from them? No, no questions. Okay, so the next thing is improving patient self-image and self-esteem. All right, you can see how there's an eye to an eye.
Yeah.
Okay. I'm looking at a teeth, but I'm looking at her eye. All right. And you know, we did. Jacqueline especially came in to take these images for us for the website, and I said, look, we're gonna do whatever you have to do. And I thought this is a perfect example of communication because we improve the patient's self-esteem and self-acceptance. I think, you know, she's a very, very important part of my practice and a good friend. But this is what it's all about, isn't it? This is what it's all about.
And you got into the psyche of where she needed the support and recognition because she's a very visual person.
Very visual.
And she's in a visual
and she's accepting
area.
her look,
Yep.
right?
Yep.
She's accepting her look, all right?
And she's happy with
She's
it.
very happy. And,
Face is relaxed and the eyes show it all. You can see in her eyes.
And I showed up. And I like this picture. She's my staff.
It's a lovely one.
And it's all about, you know, confidence.
Yeah.
Would you agree on that?
Oh, it's totally confident. And so this is a visual person. So the look.
Oh, she's
is
a magazine. She's a magazine all the
part.
time. Yeah, she's on television magazines. So I mean, that's really
so
important.
the look is everything.
Very
so
good.
you can see she's got the look she wants. You can see that it's there.
It took a lot of time to do this work. I've known this patient for about 20, 30 years. And over the period of time, she's evolved. Great family, 3 kids, gorgeous marriage, all that. She came in one day and said, she's a good friend. She said, fix my teeth. She said, okay, we'll do that for you. We'll do that for you. Well, I guess in many ways it goes saying that I love my smile.
Yeah.
You know, and it's how we put the patient together, isn't it? At the end of the day.
It is, and that's what you're after.
We pull things apart. And there's a journey of reconstitution, and we finally put it together. You know, and I work with a number of specialists, periodontists and other surgeons, etc., and you know, to get everything right for these patients.
Yeah.
And I guess when we go back and say, you know, looking back at that journey, looking back at that journey, I mean, doctor, did you deliver? Right? Then we did some. This is a patient before. All right. This patient.
So different.
So different, huh? This is diagnostic mock-up. That is a neuroplasticity pathway there.
But even the smile is different.
It's different.
Much more confidence.
Whole change in the person.
Total change.
And acceptance, right?
Yes, acceptance.
So patients accept it. And that's the important part because we listen to the patient. There's a journey involved. They didn't go from A to B. So people talk about digital smile design, which is all done digitally. And how real is real? It's not real, is it?
No.
Okay, it makes sense or not? All right, people don't understand that, you know. Like there's a couple of big known guys get on the Facebook or Instagram and they advertise about digital smile design. You arch should be this way, lips is this way. Nothing to do with that.
No.
What's real is real, right? What's digital is not real.
No.
Exactly.
Exactly. And if the perception is that's what I'm going to end up looking like.
So she knew because I sculpted the smile line in the mouth with my hands.
Wow.
Right.
Yeah.
So I knew where to take this patient. You can see I'm sculpting here, right? On the teeth to give you the smile. That's going to be translated to this.
Yeah.
That's exactly what we did. Okay. That's good.
Individual patients.
Individual patients. And
you totally catered for her needs.
Exactly.
Yeah.
And we got 2 more slides to go. Then we can invite questions from the audience if they want to participate. I think there's one question coming up right here. It says, okay, Nimesh, Rhonda, would you please advise how we can learn and include hypnosis in dentistry during consultation to help the patient choose what is best for them or even reduce their fear? We'll talk about that.
Thank you for the question.
Good question, Nimesh. Nimesh is asking good question.
Yeah, you are Nimesh.
Nimesh, like, we're going to give it to you, mate. Is it a vegetarian diet or what, Nimesh? Be honest with me.
Of course, it's all the grass.
All the grass, I love it.
I'll join you after this webinar. No. Very good, very good. About 2017, I attended Pros Academy conference in Melbourne. And, you know, everyone talks about dentistry and then we all know that, but we like to see what other colleagues do, what they think. But then again, I had a chance, I'm going to encourage my parents to listen to Professor Craig Hassan at Monash University about mindfulness in clinical practice. I heard about it, but didn't quite understand it, right? And it says being in the zone for life and work.
Yeah.
Being in the zone. And I went to a 50th birthday party recently, and I was talking to interventional radiologist. He does all the IMRT, all the cancer patients. I'll be in maxillofacial prosthetic, special shield so that protects the face. They zap particular part of cancer. So they give a maximum dose in a small area to zap the cancer. So he's the guy for it. We work together. We met him, and for some reason I met him at my friend's party. This was just 2 days ago, and I was really interested. And he asked me, he said, okay, what would you do different? What would you do different now if you had a chance again? Right. And my wife Linda has got different opinions because I've lived life longer than my wife has. And she has very interesting ideas, but I had to give my opinion. So I can't expect Linda, so I give my opinion. And I said, I would leave for today and making the most of the day. It doesn't mean I don't think about tomorrow, yes, but I will make what I have today because it is what I have to control. But if you think about being in the zone for life and work, is what really one needs to do, isn't it? Life and work. Work is life.
Yes.
Okay, work is life. You have to think about
a part of it, definitely.
A part of it, right? To me, I don't come to work. I come and I play, you know me.
Yeah.
And I have 2 passions. One is dentistry, the other is doing Argentinian tango, which I love very much. You probably know that. But that's me, okay? That's me.
Yeah.
So let's go next one. So just in conclusions, mindfulness. What's your opinion about mindfulness? Tell me a bit more about that.
Well, I've taught meditation for over 35 years.
Right.
Yeah,
right.
which is a form of mindfulness in itself. I believe mindfulness is being in the moment you're in, being in the here and the now, and really getting into the senses of everything that you're experiencing at the time you're experiencing it, and finding a centeredness in yourself and being able to be in that zone and move forward. And when we're in that place, it builds a comfort. It's wonderful for anyone that suffers anxiety or stress or depression. If you can bring yourself back to being in the moment, you're not in the thinking place, imagining the future. You're in the present place of being present now.
I agree. I agree. Well, I have a few conclusions for today's lecture. Let's talk about this. Longer mindfulness means you get thicker the cortex, so it's neurogenesis. You actually create neurons.
Yeah.
Okay, because you can think about the moment and take your time and relax. And because most of the time we overthink.
Overload it,
and most of the time we make things complex than what it is.
Yeah.
Okay, we don't give ourselves a chance to think in the simpler solutions.
It's a fact.
It's a fact. Exactly. And and in many ways, being a clinician, and you practice mindfulness every minute of your life.
Yes,
correct?
You do. You do try. We fail occasionally because we're only human, but definitely we try.
So therefore, there's an opportunity, a choice to engage or to let it go. Okay.
There's always a choice, doctor. Always a choice.
There's always a choice. You engage and let it go. You don't have to kill yourself. If the patient is not the patient that you want to have in your practice, and something that's actually giving you a grief, or you don't feel you can meet the expectations of the patient, it's okay to let it go.
Oh, totally. Totally. I'm a supervisor for counselling as well.
Right.
And it's the big thing I tell my supervisees is don't just take a patient on because they want to be with you.
Yeah.
Make sure you can support them in the journey they want and you're comfortable with that patient.
Sometimes I tell my patients, especially new patients, look, it says, I'm going to give you a phone call to make an appointment. He said, can I make an appointment? No, doctor. I said, no. I said, I want to think about your case.
Yeah.
But why? Don't you want to make an appointment? No. I want to think, do I want to take you on as a patient or not?
Yeah. Yeah.
And that puts them in a position to say, look, I really want to do the right thing by you. It's not about what you pay, whatever. There's nothing to me. Make it very clear to the patient.
But you know what you do when you do that too? You make the patient walk the walk.
That's right.
You get them off the fence, and they're
That's
either
right.
going to commit to, yes, I want to do this. Yes, I'm ready to move forward. I really would like you to take my case on.
That's right.
Or you're going to find out what their objections are.
Well, I have to tell you, there was an interesting story recently, a few weeks ago, where a very prominent man in high up in the company worth, quite sums, and he's on the BRW or whatever. He was walked in and says, "Well, I've been referred here. What you gonna do for me?" And so very much overbearing, wanted to start explaining to me that he's in charge. I said to him, "Well," I said, "look," I said, "Can I just explain you something?" I said, "I don't need you, but you need me.
Yeah.
Where would you like to go?" And he became one of the best patients. So we put him in that place.
Locus of control,
right.
exactly.
Exactly.
And that's an important part, Doctor,
Right.
because when you're working with a patient, you have to be wearing the captain's hat.
That's right. People need to understand, respect you as a clinician,
Yes.
also respect you as a human being, and respect your knowledge.
Yes.
That's very important. It's up to you to present that to the patient.
Yes.
Okay, that's something very important for you to understand. The next question would be, is that you need to engage into mindfulness program. In other words, I personally believe in that, because you have to think about this, because it's good for your soul. Would that be right? Yeah. Can we mute those people, please? Okay. And the other important thing is that mindfulness training reduces and controls the firing of amygdala, right? So amygdala is when it fires constantly your anxiety. Totally. And it destroys the central nervous system. Yeah. And it creates a career fatigue and burnout. Yeah. I have a lot of my friends who actually have left dentistry because they can't cope with it anymore. Yeah, the burnout. The burnout. Interesting. Now, well, that comes to the final thing. I'm very sorry to be so blunt in that statement, but everyone talks about multitasking. Having said that, would you agree that multitasking is absolute bullshit? Doesn't work. Yeah, you've got to be focused, really clear on where you're going and the steps that are involved in creating the outcome. One thing at a time, right? Yeah. One thing at a time, being in the zone, one time. One thing at a time. One time. And if you're trying to multitask often with a patient, you overload them with too much information. Exactly. Well, thank you so much. Thank you for having me. Thank you everyone for being fantastic. I've actually, for all my webinars, I really enjoyed this the most. Thank you. I believe that I hope the audience have received an information that they've probably never had a chance to receive. And there's a lot of science behind this. I think it's important that you think about when you go back to surgery tomorrow and how you deal with every day, how you deal with yourself. For instance, when I get up in the morning, I like to have my coffee, and that half an hour I don't want to be disturbed. I want to think about what I'm doing and get my brain in a good zone, in a very happy zone, and I'll maintain that zone. Yeah. No matter what happens, and nobody will get a rent-free space in my brain when I'm in that zone. And I wish you good night. Thank you for joining us. Until next webinar. Thank you very much. Thank you so much, Rhonda. My pleasure. Any questions? Any questions at all? There's some chats. There's some chats. Oh, amazing. Thank you. That's very much, Jesse. Nimesh, thank you. Any questions? Happy to. Okay, I think Nimesh asked that question. We've answered the question, haven't we? We answered. Well, we can look at future if anyone's interested. Thank you. We could look at doing something in the future to support. Exactly. Well, you'll be lecturing in the program, and I thank you for being part of the program. You'll be here, Rhonda. Thank you, everyone. Good. I thank you all. Stan, did you like the lecture? As a clinician and colleague, what do you think of the lecture? Was it a good idea to talk about this?
Excellent. Thank you very much for the presentation. Very well appreciated and enjoyed.
Thank you. I thank you.
An excellent presentation for both of you.
Thank you very much. Thank you. Well, more to come. There's one more before we kick off the program. So we got good students, and thank you for joining us. I can assure you one thing: this course, this degree, will be very unique in the world. You'll see it as the students come through the course, and you'll see how you will develop your own skills, and that's unique to you and we're going to teach you not to rate, learn, and have recipes in mind, but how to think, because thinking is a precious commodity. How to think and clearly and use the concept of mindfulness at that point of time, you'll be able to reduce your stress levels and help your patients in communication skills, the anxiety control, and your staff will love your deal because you're happy. If you're sad, ain't gonna work. My final call, see if you agree with me.
Yeah.
Surround yourself with extroverts, because introverts, you can't change them. It's hard work. But if you have extroverts around you, they're like you if you're an extrovert. If you're an introvert, good luck to you. I'm sorry, I can't deal with it. I'm an extrovert. You're an extrovert, aren't you?
I'm an extrovert.
Yeah. I wish all the introverts the best of luck. I want you to be as happy as you can, but try to change because you don't know what you're missing. Good night.
Good night, everyone.
Thank you. I think they're all happy.
That was great. I had fun. I enjoyed it. Thank you.
It was so fun. See you guys. See you. Why did we get a little lecture? All right.